Hello, my name is Danny. I'm a nurse practitioner student. I'll be doing a head to toe examination of you today. Do you have any questions for me? Okay, I'll be letting you know how you can assist me throughout the exam and instructing you as we go along. I'm noting her general state of health. She appears in good physical health, but she doesn't appear in any emotional or physical distress. I'm also throughout this exam, we'll be noting skin, looking for temperature, turgor, moisture, lesions, hair distribution, and any scarring. I'm going to begin with your hands. So spread your hands out for me. I'm looking at the joints of the hands. I'm looking for any deformities, any swelling or redness, any pain or tenderness there. Okay, moving down to the nails, I'm looking at tap refill and it's brisk, it's less than 30 seconds. Go ahead and I'm going to have you squeeze my hands. Good. Grip strength is equal bilaterally. It's 5 out of 5. I'm going to have you do this for me. Okay. And I see a good diamond window appearance, which denotes there's no clubbing in her fingers. Moving into her wrist, I'm looking for swelling, tenderness, any nodules, any pain or tenderness there. Okay. You're going to feel the pulses of your wrists now. Throughout the exam, as I assess pulses, I'm looking for rate, rhythm, symmetry, and amplitude. I note that the rate is approximately 75, rhythm is regular, amplitude is symmetrical bilaterally, it's about 2 out of 4, it's not bounding or thready, and feeling up arms, you can just relax your arms for me there. Good. I'm looking at symmetry of the arms, looking for any atrophy of the muscles, any swelling or red warmth, any pain or tenderness there. Okay. Feeling the opening processes of the elbows for any pain or tenderness, any warmth or swelling, any pain there. Okay. I'm going to have you do some movement of your elbows. I'm going to have you bend here. That's flexion of the elbow, and then out. That's extension. Go ahead and put your palms to the ground. That's pronation, and then up towards the ceiling. That's supination. So full range of motion of the elbows. I'm going to feel your shoulders now. Feeling the glenohumeral joint of the shoulder. And no warmth or swelling of the joint. Do you feel any pain there? I'm going to have you move your shoulders for me now. So I'm going to have you raise up above the head. That's flexion of the shoulder and back behind. That's extension of the shoulder. I'm going to have you cross your arms across your body. That's adduction. And then away from your body. That's abduction. And go ahead and put your hands behind your neck. That's external rotation. And then back behind your back. That's internal rotation. And then checking for symmetry behind the back. Now I'm going to have you pull against me here. Good, and that's bicep strength. And push against me, that's tricep strength. Now I want you to hold your hands out like this, and I want you to resist me pushing your arms down. Good, and that's deltoid strength, and they're all 5 out of 5 equally. Now I'm going to move into the assessment of your head and your neck, okay? So first I'm looking at hair distribution. I'm looking for any balding or any patchiness. I'm also looking through the hair and behind the ears for any rashes or infestation, of which I see none. Now I'm looking at the eyes. The eyes are symmetrical. I see no lid lag, exophthalmos, or swelling. I'm going to be assessing cranial nerve 2 optic. Do you wear any contact lenses? Okay, so that's visual acuity. Oh, yeah. Oh, you do? Okay. So now I'm assessing cranial nerve 3 oculomotor, cranial nerve 4 trochlear, and cranial nerve 6 abducens. So I'm going to have you follow this pen with your eyes. Try not to move your head for me. So I'm looking at extraocular movement. Assessing for any nystagmus. So I'm going to pull your eyelids down here. Just move your eyes back and forth and up and down for me. Good. And I don't see the sclera is white and the conjunctiva is clear. I don't see any redness or exudate. So now I'm going to be assessing cranial nerve 2 optic and cranial nerve 3 oculomotor, looking at pupillar response. So I'm going to be shining a light in your eyes, okay? So first I'm assessing direct pupillar response in the right eye. Good. And then consensual in the left. And I have restrictions. And then same on the other side. direct in the left and consensual in the right. Okay. So now I'm going to look at accommodation, which again is cranial nerve 2 optic and cranial nerve 3 ocular motor. So go ahead and take a look at this pen here and then pick a point over my shoulder and look away and then look back and away. Good. And I have constriction up close and dilation out far, which is accommodation. So next I'm going to be looking at the health of your eye. Okay, so I'm going to be coming in close to you. So I'm placing my hand on your head and 15-degree angle and finding the red reflex and coming in close. Good. And I'm going to come around on the other side and do the same. And the red light reflex. And the angle coming in. Good. And on both sides, I see the red reflex. The optic disc margins are crisp and clear. I don't see any papular edema. In all 4 margins, I see no signs of AV nicking, lesions, or hemorrhaging. So next, I am going to be assessing cranial nerve 1 olfactory. Have you noticed any changes in your sense of smell? Okay. Able to smell coffee in the morning and everything? And then I'm going to be assessing your cranial nerve 8 acoustic. So can you plug your ear for me? Okay. I'm going to whisper a series of numbers and letters, and I want you to repeat what you hear. AB7. Okay, and now we're going to do the same on the other side. 7, 6, 8. Great. Okay. So now I'm going to assess the outside of your ears. So I'm going to just touch you. Let me know if anything's painful. So I'm feeling the auricle and the tragus of the ear. I don't note any swelling or discharge. Okay. Now I'm going to be looking inside of your ear. So I'm going to sit down here next to you, okay? I'm pulling up, out, and back and bracing myself on the patient here. Good. Coming around to the other side. Move your hair out of the way here. Up, out, and back. And on both sides, I note that the ear canal, I don't see any drainage, swelling, or discharge. The tympanic membranes are both mid-position. They're pearly gray. I have good cones of light on both sides, and bony landmarks are present without any perforation or bulging. So next, I will have already assessed whether there's any change in smell for cranial nerve 1. I'll be looking at your inside your nose. So go ahead and just tilt your nose back for me, okay? Okay. And the inferior turbinates are pink and moist. I don't see any signs of polyps or lesions, no swelling or erythema, and the septum is midline. I see no signs of deviation or perforation. So next, I'm going to be looking inside of your mouth. Have you noticed any change in your sense of taste? Okay. So assessing cranial nerve 7 and cranial nerve 9, cranial nerve 7 facial and cranial nerve 9 glossopharyngeal. So go ahead, open your mouth up for me. Okay. And looking inside, the buccal mucosa is pink. I don't notice any signs of lesions or masses. The hard palate and soft palate are intact. I don't see any leukoplakia. Go ahead, lift your tongue up for me, okay? I don't know any masses or polyps at the base of the tongue, no swelling of the ducts. Dentation is intact. I don't notice any caries, okay? I'm going to have you go ahead and say ah for me. Good. Closing up that. The uvula rises midline and the soft palate rises and falls symmetrically. That's the assessment of cranial nerve 10 vagus. I'm going to now put a glove on here. And I'm going to be feeling inside of your mouth. feeling the lips and underneath the tongue. So I feel no massive lesions or swellings at the base of the tongue and around the lips and mouth. I'm going to assess cranial nerve 12 hypoglycemia. So go ahead, stick your tongue out at me and move it back and forth. Okay, and then you can put your tongue back in your mouth and just press it against your cheek. So tongue is midline with no deviation, and strength of the tongue is symmetrical bilaterally. So now I'm going to assess cranial nerve 5 trigeminal, which is assessment of the muscles of your jaw. So go ahead and clench your teeth for me. Good. And this is the masseter and temporal muscles are symmetrical bilaterally with no atrophy. Now go ahead, open and close. Good. And I don't assess any crepitus or any swelling, but she does have some clicking in her jaw. Does that have any pain for you? Okay. So now I'm going to assess cranial nerve 7 facial. So I'm going to have you make some funny faces for me. Go ahead and smile and frown. And show me your teeth as best you can. Good. And puff your cheeks out. And now close your eyes really tight for me. Don't let me open them. Good. And now open your eyes up really wide. Great. Okay. So cranial nerve 7 is intact. Facial features are symmetrical. And next I am going to assess cranial nerve 12 or 11, a spinal accessory. So I'm going to have you shrug your shoulders for me. And there's this. Good. So that's trapezius muscle strength is symmetrical bilaterally. And now I'm going to have you turn your cheek towards my hand. Good. And the other side. And that's sternocleidomastoid strength. And that is symmetrical bilaterally as well. Now I'm going to have you do some range of motion with me. So I'm going to have you touch your chin to your chest. Good. And that's flexion of the neck. And now look towards the ceiling, that's extension of the neck. Now I'm going to have you turn your chin towards your shoulder, good, and the other way, and that's rotation of the neck. And then tilt your ear towards your shoulder, good, and that's lateral bend of the neck. And she has full range of motion in her neck, and I don't note any crevices in her neck. Next, I'm going to assess your lymph nodes. So you're going to feel me touch. You let me know if there's any pain or tenderness where I touch. This is preauricular and postauricular, and occipital, and tonsillar, submandibular, submental, posterior cervical, deep cervical, superficial cervical, supraclavicular, and infraclavicular. And I don't note any palpable nodes, nothing hard or fixed, tender or warm. Was anything painful for you there? Okay. So now I'm going to assess your neck, your trachea, and your thyroid. So I'm going to give you this water here. And first I just want you to take a sip and go ahead and swallow for me. And trachea is midline. I see no deviation. Next, I'm gonna have you take another sip, but I want you to hold it in your mouth and wait for me to tell you to swallow, okay? I'm gonna come around behind you. You're gonna feel my hands on your neck here, and I want you to tilt your head down for me and go ahead and swallow. Okay, so I'm feeling the isthmus of the thyroid. Now I want you to take another sip and hold it in your mouth. Tilt your head down and slightly to the left for me. Okay, and go ahead and swallow. Feeling for the left lobe of the thyroid. Now I'm going to have you do the same, except I'm going to have you tilt your head to the right. So tilt your head down and then hold it in your mouth. Good. And go ahead and swallow. Good. And I feel the right lobe, and I don't feel any nodularities or enlargement of the thyroid. So I'm going to remain back here. We're going to listen to your lungs now, okay? So I'm assessing the thorax. I'm looking at the AP diameter, which is less than the lateral diameter of her chest. Go ahead and we can set that down for you. Okay. I'm going to have you take a nice big deep breath for me. Good. And the rise and fall of her thorax is symmetrical as she takes a deep breath. I'm going to palpate that now. So I'm going to just reach in here and take another nice big deep breath for me. I'm looking at the 10th rib here. Okay. And as she breathes, again, the rise and fall is symmetrical, and I have less than 3 centimeters of expansion between my thumbs. Now I'm going to feel your spine, okay? So starting at C7, I'm feeling the spinous processes, feeling for any protrusions, step outs. Any pain or tenderness here? Mm-hmm. And now I'm feeling the paravertebral muscles. Looking for any vesiculations or spasming. Feeling any pain or tenderness there? Now to the gluteal fold here. I'm going to be listening to your lungs now. I don't feel any spasming or vesiculations there. This is what my stethoscope feels like. Every time you feel it on your back, I want you to take a nice big deep breath with an open mouth. Now you lift your right arm up for me. Okay, I'm going to come around to the front of you now. We're going to do the same thing in the front. So nice big deep breath. And breath sounds in the posterior, the right, and the anterior lung fields are all bronchiovesicular breath sounds with no adventitious sounds like wheezes, crackles, or rails. I'm going to listen to your heart now, so you can just breathe normal during this assessment. So starting at the center, second intercostal space on the right sternal border, I'm listening to the aortic valve. Your S1, S2, no S3, S4, or murmurs. Moving across to the center, second intercostal space on the left sternal border, the pulmonic valve. I hear S1, S2, no S3, S4, or murmurs. Moving down the left sternal border to the tricuspid valve. I hear S1, S2, no S3, S4, or murmurs. Can you lift your breast tissue for me? I'm coming down to the fifth intercostal space, the midclavicular line. Listening to the mitral valve. I hear S1, S2, no S3, S4, or murmurs. I'm going to now feel the arteries in your neck, okay? Feeling the palpating the carotid arteries one at a time. And rate is approximately 75. Rhythm is regular. Amplitude is not bounding or thready. It's about 2 out of 4. Other side is symmetry is symmetrical, about 2 out of 4, not bounding or thready. Rate is approximately 75. Rhythm is regular. I'm going to listen now. I just ask that you refrain from speaking or coughing while I'm listening. And I do not note any bruits or murmurs. So I'm going to be assessing your nodes inside of your armpit. Here, let me take that from you. So this may feel uncomfortable, all right? So I'm just relax into my arm for me. Palpating the central nodes. I'm not noting anything greater than 1 centimeter, fixed or warm. Again, nothing greater than 1 centimeter, fixed or immovable or warm. Anything tender there for you? Okay. So we're going to move on to the breast examination. So what I'm going to have you do is place your hands on your hips and squeeze your chest muscles for me. With the breast examination, I'm looking for any asymmetry, any masses or lesions. I'm looking at skin pattern and venous pattern. I'm looking for inversion of the nipples, and I'm looking for any retractions or immovability of the breast. Go ahead and lift your hands up over your head. Again, with movement, I'm looking for any gross asymmetry and any areas of the breast that do not move freely when she moves. I'm going to have you rest back for me now. I'm going to do the hands-on assessment of your breast. So I'm going to place to your shoulder here. Put your hands up over your head for me and tilt your hips towards me, okay? Or, sorry, tilt your hips away from me. Yeah, great. So when we get to the midpoint of your breast, I'm going to have you move your hips back to the middle. So as I do the breast assessment, I'm going to start in the axillary tail of the breast and the armpit. And I'm going to move in a vertical stripe pattern in circular motion with my 3 fingers, doing a light, medium, and deep pressure as I feel for the tissue of the breast. Starting here, moving down, light, medium, deep, light, medium, deep, light, medium, deep, light, medium, deep. And I'm feeling for tissue consistency and any masses, lumps, immovable tissue. Are you having any pain or tenderness at all with this? Yeah. Once I reach the nipple, I'm looking for any discharge at the nipple. Go ahead and move your hips back towards me, and then you can place your hands down by your ear. Moving all the way up to the tissue to the collarbone, light, medium, and deep. And all the way to the sternal border tissue. And we're going to repeat this on the other side. So I'm going to move this pillow over to your other shoulder. And now you can turn your hips towards me and put your hand up over your head. And we're going to do the same thing. So starting at the axillary tail, moving down 3 different levels of touch. Anything painful or tender for you? No. And looking for tissue consistency, any lumps, masses, anything immovable. And all the way down. That's your collarbone. Go ahead. Move your hips back to the middle. Move your hand down to your ear. Sternal border tissue. Throughout the exam, I didn't notice the tissue was consistent. I didn't have any lumps or bumps that were immovable, and no sign of discharge at the nipples. Any pain or tenderness throughout the exam? Okay. So you can place your arm down by your side. I'm going to look at the pericardium now. I'm assessing for any lifts or heaves or impulses or any deformities of the pericardium which you don't see. I'm now going to be listening again at all of the valves of the heart with the bell of my stethoscope for any murmurs. So starting at the second intercostal space, at the right sternal border for the aortic valve. No murmurs. Pulmonic valve, second intercostal space, left sternal border. No murmurs. Moving down to the tricuspid valve, left sternal border. No murmurs. I'm going to have you lift your breast tissue for me again a little bit. I'm going to the fifth intercostal space, mid-clavicular line for the mitral valve. No murmurs. I'm going to have you continue to lift your breast tissue for me for a minute. I'm going to find a point of maximal impulse or the apical pulse. One finger. And it's at the fifth intercostal space, mid-clavicular line. It's not enlarged or displaced. do an assessment of your belly now, so I'm going to have you lift up your shorts down just a little bit for me. Thank you. So first, I'm just inspecting the abdomen, a little bit of tangential light. I'm looking at the contour of the abdomen, the skin, looking for any venous changes in venous pattern, looking for scarring, striae, hair distribution, any excoriation, or lesions of which I don't see, and no massive, visible masses. I'm now going to listen with my stethoscope. First starting with the bell of my stethoscope to the arteries of the abdomen, starting with the aorta, and then the renal, the iliac, and I don't hear any bruits. Now I'm going to listen again to your tummy here, listening to the bowel tones in all four quadrants. And then your normal active bowel tones, gurgling with no spacing in between. I'm going to now be tapping gently on your tummy. Let me know if anything's painful for you. So I'm going to be percussing the abdomen and all 9 regions in a lawnmower action. So I have tympanic sounds throughout with a little bit of dullness in the left lower quadrant, which is consistent with your stool. I don't know any sense of fluid or air masses. So I'm going to be pressing gently on your tummy. Let me know if anything's painful. So first I'm just gently feeling in the all 9 quadrants, noting my patient's face for any pain or burning. Now I'm going to be pressing a little deeper, okay? Let me know if anything's uncomfortable for you. Now I'm pressing deeper, noting for any rigidity, guarding, tenderness, or masses. And I note now. Now I'm going to do a technique that feels for your liver, okay? So you're going to feel me along your rib line here with my finger, and I want you to take a nice big deep breath for me. Okay, and breathe out. And I don't palpate the liver, which is an expected finding. So I'm going to reach across here with my other hand, and I'm going to do the same to feel for your spleen. So reaching with my left hand underneath the CPE, and you're going to feel me under your rib line here. So go ahead, take a nice big deep breath, and breathe out. And I don't palpate the spleen either, which is an expected finding. So you can go ahead and put your top down. You're going to feel me in your groin area now, okay? So first I'm palpating for the femoral pulses. And they are symmetrical bilaterally. They're not bounding or thready. Amplitude is 2 out of 4. Rate is approximately 75. And rhythm is regular. Going to feel in your groin now here for the lymph nodes. Anything painful or tender there? And I don't note no palpable lymph nodes, nothing fixed or warm. I'm going to be feeling now in your hips. Anything painful or tender there? No swelling or warmth in her hip joint. Feeling down the legs. As I assess the legs, I'm looking for symmetry and alignment. Feeling the quads. I don't feel any warmth or swelling in the quadriceps. Can you squeeze your muscles for me? Good. You feel symmetrical leg strength there. Feeling the patella of the knee and the tendon. Feeling joint line here. Any pain or tenderness in your knee? Okay, I don't feel any warmth or swelling there. Feeling down the shin and the gastrocnemius. I don't want any warmth or swelling in the shins or gastric knees, any pain or tenderness there. Feeling down into the ankles and into the feet. No warmth or swelling there. Any pain or tenderness? Okay. I'm going to feel the dorsal pulse. Again, they're symmetrical bilaterally, 2 out of 4 amplitude, not bounding or thready. Rate is approximately 75, and rhythm is regular. We're going to do some range of motion in your hip, so I want you to just relax into my hand, okay? So we're doing flexion of the hip and then flexion and extension of the knee. I'm going to just move your leg in here. That's internal rotation of the hip and external rotation of the hip. I'm going to lower your leg here and I'm going to brace your hip. This is abduction of the hip and adduction of the hip. Wonderful. Now we're going to do the same thing on the other side. So this is flexion of the hip, flexion and extension of the knee. Now we're going to do internal rotation and external rotation of the hip. And now we're going to lower your leg. I'm going to brace your hip here. I'm going to do abduction of the hip and adduction of the hip. So she has full range of motion in both of her hips. Any pain or tenderness with that? Okay. Now we're going to do some active range of motion with your ankles. So I want you to point your toes towards your nose. And that's dorsiflexion of the ankle. Now point your toes towards the floor. That's plantar flexion. Now turn your soles towards each other. That's inversion. And turn your soles away from each other. That's eversion. Great. I'm going to have you sit up for me now. We're going to do a coordination test. So I want you to place your hands on your thighs and then slap the backs of your hands on your thighs. Okay, you're going to do that as fast as you can. Great. That's perfect. So that's cerebellar function. It's smooth. It's not jerky. Next, I'm going to test your reflexes. So we're going to start with your biceps here, and I just want you to relax into me as much as you possibly can, okay? Okay. That's 2 out of 4 in both biceps. Now we're going to do the triceps. So just try to match your arm. There you go. Okay. Now, triceps. Relax your arm for me. Good. That's 2 out of 4 in the triceps. Now I'm going to come down to your knees here. So can you uncross your legs for me? I'm going to do the patellar tendon here. Okay. Okay, so I'd say that's about 3 out of 4 in the patellar tendon. Now we're going to do the Achilles tendon. And I'd say that's trace in the right and 1 out of 4 in the left. All right, so I'm going to have you stand up for me now. So I'm assessing the curvature of her spine. So I'm looking at the concavity of the cervical and the lumbar spine and the convexity of the thoracic spine. I don't note any pronounced lordosis or kyphosis of the spine. Her hips and her shoulders are equal heights. I'm going to have you turn for me and bend and touch your toes. So I'm looking for any scoliosis. You can stand back up, and that's flexion of the spine. I don't note any scoliosis. Now I'm going to stand behind you, and I'm going to have you bend back for me, and that's extension of the spine. Now I'm going to stand here, and I want you to, without turning your legs, turn around towards me. Good, and the other way, and that's rotation of the spine. Now go ahead and slide your right hand down your right thigh. Good, and then the other way, and that's lateral bend of the spine, so she has full range of motion in the spine. Now turn around and look at me. I'm going to have you do an exercise. You're going to stand on one of your legs, and then I'm going to have you dip and bend your knee. Good. And do the same on the other side. So that's the single partial knee bend. She has good balance and equal strength bilaterally. Now the final thing is I'm going to have you walk for me. I'm going to have you just walk normal out here and back. So with gait, I'm looking at symmetry and balance. Good. And now on your tiptoes for me. And then back on your heels. And your final test is going to be walking 1 foot in front of the other, heel to toe. Perfect. So again, I'm looking at balance, symmetry. I'm looking for any leg, any shuffling, any wide gait, and any asymmetry of the arm swing. Perfect. Thank you very much. That ends my physical exam. You can sit down for me. And now I'm going to talk through the male and female GU exam. With a male, I would start in myself a seated position and him in a standing position. I would instruct him on when and where I'll be touching him. I would don gloves and start by inspecting the genitalia, looking at for maturity, hair distribution, looking at it for any erythema, excoriation, looking for any warts or lesions or discharge. I would then start by palpating the shaft of the penis and looking for any signs of swelling or discharge. I would then move on to the glands of the penis. If the patient is not circumcised, I would have him retract his foreskin, looking for any discharge or excoriation. I would then assess the urethral mediatus. From there, I would move on to assessing the testes one at a time. I would feel the testes for any nodularity, swelling, or masses. We move back to the epididymis, and then to the spermatic cord. Following the spermatic cord with one finger, I would feel up into the external inguinal ring and have the patient turn and cough, feeling for any inguinal hernias. I would then proceed to examine the other testes in a similar manner, following the testes, epididymis, then the spermatic cord, and then with one finger up, assessing for any inguinal hernias in a similar manner. I would then proceed to the prostate exam. I would don new gloves and lubricate my index finger. I would let the patient know what we're going to be doing. I would position him in a bended position over the examination table. If that's not comfortable for him, he can lay in a left lateral lying position. I would inform the patient to bear down. I would then place my finger in his rectum, feeling for the lobes and the median sulcus of the prostate. The prostate should be less than 1 centimeter of rectal protrusion. It should feel eraser-like, firm, slightly movable, and non-tender. I would then do a 360 of the rectum, assessing for any masses or lesions before removing my finger. And if I have any stool on the glove, I can send it for an occult stool sample. Would then help the patient clean up and move back into a comfortable position. For the female exam, I would seat the patient in a lobotomy position and use appropriate draping to maintain eye contact. I would instruct the patient on when and where I'll be touching her. I would don gloves and then place the back of my hand on the inside of her thigh before proceeding to the genitals, so just let her know where I'm touching. I would begin by assessing the patient's mon pubis, labia majora, labia minora, clitoris, urethra, introitus, and anus and perineum for signs of maturity, hair distribution, erythema, warts, lesions, discharge, or masses. When that assessment is over, I would let the patient know that I will be doing the speculum exam. I would let the patient know I'll be placing the finger in the vaginal opening. To secure the opening, I would use my speculum, which has been lubricated in warm water, to initiate into the introitus at a 45-degree angle. Once I've moved past the introitus, I would turn my speculum 45 degrees, or turn my speculum horizontally. Once I'm all the way in the vagina, I would open my blades. If I cannot visualize the os or the cervix, I can remove my speculum about 1 centimeter and do upward. I would have applied downward pressure to enter. I would then use upward pressure. Once I visualize the os and cervix, I can lock my blades. I would assess the cervix for any discharge, erythema, bleeding, or lesions, and then assess the vaginal walls for any erythema, discharge, or lesions. Once I'm done with my assessment, I would unlock the blades and then remove the speculum from the os and cervix. Once I've removed it from the os and cervix, I can close my blades and apply downward pressure to remove my speculum from the vagina as I turn back 45-degree angles. Once I'm done with the speculum, I can stop there.
such rules.
Is this actually a bathroom?
I don't. I'm not sure. Oh, it is, but it's cluttered.
Okay.
Oh, there's lots of it.
It's not possible, you said.
Yeah, you can.
Oh,
There's just
really?
lots
Oh, awesome. Okay. Oh gosh.